Hi, I work at the North Sydney campus of the Australian Catholic University. I'm also a PhD candidate at the University of Sydney. So the presentation that I'm going to give you today, I recently gave, as you can see on the opening slide there, at the recent AALL conference in Wollongong in November. And it's the first stage of the analysis of my PhD data. So one of the things that I would very much welcome is if you have any suggestions or any sort of constructive criticism that you might want to pass along to help me tighten up this analysis, that would be fantastic. I would very much welcome it. So I'll go ahead and jump right in. So the focus of my research area has to do with beginning writers. A lot of times when I'm looking at the literature around novice writers, it's often around beginning postgraduate students. One of the things that I was very interested in is looking at how students in their first year, particularly in their first year of university study, make that transition and how they make sense of things that are required of them, specifically in written assessment. So I think one of the things that all of us have experienced as we work with beginning writers is that how they use sources is often an area that's quite challenging to beginning writers. And Razivanic uses the term intertextual practices to talk about the ways that students draw on other source texts to make meaning in their own writing. And that's going to be the focus of this presentation as well as my PhD thesis. So the aims of my project are to look at the intertextual practices of students in one of the first writing assessment tasks that they do at university. This is a mixed method study, so there's a quantitative component, which I'll be talking about today, as well as a qualitative aspect to the study, which is my ongoing work at the moment. Hopefully, by looking at what they've done with sources inside their text, we can develop an understanding of how students have interpreted the expectations that their lecturers have and that the university has, and understand sort of where the gaps might be with them. One of the things I'd like to make clear in this presentation is this is an exploratory study, not an evaluative study. So my purpose isn't necessarily to look at their intertextual practices and determine how well they're doing them or how poor they're doing them. It's not to determine whether they're for example, using appropriate paraphrasing of source texts. I'm not looking for things like plagiarism or whether they're complying with honesty policies, things like that. Really, the purpose of my study is to have a look at their writing and see if by looking at their particular practices, we can understand what messages are getting through to them about the expectations and how they can be successful as academic writers, particularly around source use. So there were 174 students who were enrolled in a first-year core health sciences unit who agreed to participate in this study. The groups of students that agreed to participate were Bachelor of Physiotherapy and Nursing students were the course groups that were enrolled in the unit. One of the things that I think that's important to stress at this point is that this was the first time that the physiotherapy degree was offered. It also has there's a significant difference in entry requirements for these two degree groups. So the physiotherapy course is it's a very difficult, a very competitive degree, and the entry cutoffs are quite high in the 90s. The Bachelor of Nursing is also a very popular degree, but its cutoffs are about 30 points lower than the Bachelor of Physio. So you'll see that there are quite different course groupings in the analysis as I go through. There were a division of male and female, and I also broke the students. One of my other analytical categories was the students' language backgrounds. So students were classified as English-speaking backgrounds through the use of a survey. I asked what language they used primarily at home, and if any other languages were used at home with their family. If they said English was their primary language at home and the only language that they used at home with their family, that they were categorized as English-speaking background students. If they said English was not used in their family or was one of a number of languages that was used in their family, they were classified as non-English speaking background students. And there were quite a significant number of NESB students in our cohort, according to those designations. And then I also further divided the groups into, for non-English speaking backgrounds, those who are local students and those who are studying at the institution on a student visa in Australia. I collected essay tasks from each of these, from the students who agreed to participate in this study, and the task that they were responding to is on the screen now. This is a psychology unit, part of the curriculum that the students are undergoing as they take this course requires them to study a variety of different units in their degree of course. Many students indicated that for them, they felt that this psychology unit, they identified it as different from the other units that they were taking, things like anatomy or biomedical sciences, things like the foundations of nursing. For many of the students that I talked to, they saw this as a different kind of unit, dealing with things that were conceptually different from their other courses, their other units. So this task in particular asked them to look at a specific model of behavior change, identify a health risk behavior that a patient might exhibit, and then discuss how this model could be used with that particular patient, particularly in the early stages of the model. They had to draw on sources to support their argument. They had 1,000 words to respond to the task, and it was worth 35% of the marks for the unit. For many of the students who participated in the study, this was one of the first assessment tasks that they completed in their university studies. The marking criteria for the task, I think, will probably look very familiar to many of you. There were aspects of the marking criteria, an introduction and a closing paragraph that dealt with structure. So they were asked to have a very specific essay structure for their response to the task. The kinds of evidence they provided and the examples that they gave, how they ordered their ideas within the task, the types of sources that they chose and how they cited them, and then things like how they structured their sentences and paragraphs, and then basic mechanics were also allocated marks in the marking criteria. So for my project, for the quantitative aspects, there were 2 research questions. So the first research questions dealt with just identifying what kinds of practices students were using and how much or how often they were using them. And then to look at these 3 student groupings to see if different students were doing things in slightly different ways. So I looked at students from their course groups, students from their language backgrounds, and then within their NESB background groups as well. So I collected 174 essays. Ask me anything about the trans-theoretical model of behavior change. I know a great deal about it now, or at least as much as 174 first-year students know. 2 of the essays had no attribution. That means they didn't cite any sources in their assignment, and so I excluded them from the analysis because the purpose of the quantitative analysis was to look specifically at how they used attributed information inside their text. I broke those essays down into C units, so that was my unit of analysis, rather than T units, which require a verb, because these first-year students were doing things like lists. They were attributing statements to patients and healthcare practitioners, so I went with C unit instead. And then I identified which of those units of analysis students indicated attribution, and then I coded that attribution across 4 categories that we'll look at more extensively as the presentation goes on. The average mark, the mean score for the students was 21, so that's a strong pass. Physio students, not surprisingly, tended to have a higher score, and it was a statistically significant difference. But there didn't seem to be any statistically significant differences between the language groups or the local and the international NESB students. In terms of how much of their word count was dedicated to source use, around 30%. And again, there was no significant difference between the language background groups or the courses. However, international students, it was indicated that they were using more attribution. They were using more of their word count towards attribution than were the other groups. Within the overall framework of the essay, with an introduction, body, and a conclusion, most students seem to know that they needed to have those three aspects. If they did omit some part of that structure, it tended to be the introduction. And when they did use attribution within that larger macro structure, it mainly fell within the body of the essay. And then the rest of it was pretty evenly distributed between the introduction and the conclusion. And this was across all the cohort, all the groupings in the student cohort. So I think students received very, very clear instruction from their lecturer and from the support materials that they received about what an essay looked like, what the structure was, and what elements they needed to include in it. And I think you can see from these numbers that they were attempting to meet those expectations. When students used attribution in the introduction of their assignment, they were using it to do exactly the kinds of things you would expect them to do in an introduction. They were identifying the model. They were identifying what the purpose of the model was, or they were saying what the health behavior that they would discuss would be. So again, they are trying to use those sources to set the stage for their further discussion. In the body of the essay, where the majority of the attribution tended to fall within this group, one of the interesting things that I picked up in terms of how they were using attributed information was they indicated that information came from an external source, but either it wasn't an academic source. They were saying a patient might say this kind of thing and you might respond to it in this way. But there were also a number of examples of students saying, psychologists have published numerous studies where they say these things, but they don't say what those studies are, or research has found. So they're referring to research, but they're not going that next step and then actually telling you the information that you can use to either locate that source or evaluate that source as a reader. In the conclusion, there's far, far less attribution in that section of the assignment, but when they do use it, they're structuring their conclusion almost identically to their introduction, but just saying in conclusion first. So again, they recognize that they need to have it, and they are sort of, in their mind, summing up, but basically they're restating the introduction and they're using the same kind of source use in the conclusion as they do in the introduction. One of the other categories that I used to look at how students were incorporating information had to do with whether they used quotations, direct quotes, or paraphrases. Across all of the students in the study, they indicated that they thought they were paraphrasing more than they intended to incorporate direct quotes. I used that phrasing. Again, because this is an exploratory study, I took them at their word. We're on the honor system here. So again, my interest wasn't in did they actually paraphrase when they thought they were paraphrasing, but what did they think their lecturers wanted them to do with their sources. So these students were indicating that they were at least attempting to create a paraphrase far more often than they were attempting to integrate direct quotes. And they were also not integrating those citations into the grammatical structure of the sentence. So the citations were occurring strictly in the brackets at the end of the sentence, and they were not providing information about the author or information about that in the sentence itself. There weren't any differences between the groups in the amount of paraphrases versus quotations or how they incorporated them. And this is pretty consistent with other studies about academic writing that have been conducted. So here we're kind of getting to the meat of it now. The purposes that they use sources fall into two main coding categories. Microstructure looks at the task itself and how they used attribution to respond to elements of the task. Function has to do with how they used those sources as a writer. And we'll look in more detail at each of those categories. So again, microstructure is related to the task. This task asks students to take a particular behavior change model and apply it to a particular patient risk behavior. But it wasn't just enough to focus on the what. To be successful in a task, the students couldn't just say what the behavior was or what the model was. They had to say how a healthcare provider could use that. So they had to look at specific strategies that would be useful in this scenario. And so when I looked at microstructure, I looked at those particular aspects of the tasks and allocated out attribution to the different areas that students might use to respond to it. So the first category I called was aspects of the model. This encompassed whether they were using sources to either describe the model, list its stages, or name the risk behavior and the characteristics of that behavior. So again, it's not that that's not an important part of the task, but that can't be the main focus of the task. So overall, as a whole cohort, students tended to be using their sources to talk about what the model is rather than how it's used. Nursing students tended to do this more than physio students. It was a significant difference, but a small effect size. But there weren't any differences between the language groups. And this is something that we're going to see consistently as we're looking at microstructure and function. What I'm taking away from this is a beginning student issue, not an international student issue or non-English speaking background student issue. Basically, when students come into university study, my belief is they all need some contextualizing that helps them understand how evidence works. And I think part of what we're seeing, as I'll go through the other slides, is that where students can articulate that the expectations have been made explicit, I've got to have an introduction, I've got to have a body, I've got to have a conclusion, they are trying to do that more or less successfully. But I think in some of these areas around how they use the sources, students weren't necessarily talking about it in those terms, and I think the texts show that they're not necessarily aware of the role that evidence can play in their writing. So when they're describing the aspects of the model, for example, they're defining what the stage is. So the first stage is the pre-contemplation stage, and they're saying what it is. Or they're listing the many risk factors and their potential effects on behavior or on this patient's health. However, to be successful in the task, students need to apply the model. They have to give strategies and say how the model can be used by a healthcare practitioner to benefit a patient. Physiotherapy students, that course group, tended to be the group that was using their attribution in service of applying the model more than the nursing students were. It was a significant difference, but small. Again, no difference between the language groups here. Another thing that I'd like to make clear is that it doesn't mean that students weren't providing strategies. It doesn't mean that they didn't give those specific things that healthcare providers could do. They just didn't use their sources to provide evidence that that was a useful strategy. So when they were citing sources and providing attribution, they tended to do it for the what is it? It's what the model is, or what the behavior is, or what the goal is even, but not, and this is how I know that this strategy is a useful one. So students were applying the model, they just weren't using their sources to provide evidence that their recommendations were effective, which is interesting because one of the core principles, one of the core concepts that comes out of a degree like nursing is this evidence-based practice. So this idea that when you make a suggestion or you carry out an activity with a patient, it's based on evidence, and you're choosing that particular activity based on your research and your evidence, and you can demonstrate that you've made the right decision by referring to the literature. I'm not sure that that's kind of trickling down. Again, these are first year, first semester students. So what I think this is doing is actually indicating an area where we could benefit by increasing the instruction or drawing their attention to it more explicitly. So some examples of how students might use it to apply rather than to describe the model. It can show ways that healthcare providers can communicate with patients about the model, or it can provide specific questions or specific things that they can say or do with the patient. And this was a very common way that students created recommendations for strategies. The final category that I'll talk about in the quantitative analysis has to do with the function to which students put the attribution in their assignments. So overall, as a group, you're looking at about a 50-50 split, but there seems to be more focus on describing, listing characteristics, providing definitions, those kinds of things, than the how questions or the analytical or the evaluative work. And again, nursing students tended to be more descriptive than the physiotherapy students. Didn't find any differences between the language background groups or the NESB groups in my statistical analysis that were significant. So descriptively, here are some of the things that our students doing. Many of them spend a great deal of effort and a great deal of their source use in defining very basic terms. And this also came through quite clearly in the interviews that I conducted with the students. So oftentimes they had questions for me, and they would say things like, I'm not sure what things I need to be defining. I don't know what terms it's important that I define. And so sometimes I think our conversations also need to be around, well, there is a place for definition, and that can be part of what you're doing, but that's not the only reason that you can use your sources. And they often had very long lists of either components of a model like you see here, or risk factors for a behavior. They just take a chunk out of the source and list every one of them, often using direct quotes in the situation for their lists. And that was another, when we were talking about the difference between quotations and paraphrases, they would say, I don't know how to paraphrase this, especially when you see long lists. So they're thinking they need to reproduce the list, but they're not sure how to paraphrase the list. So I think some of our conversations also can be more about how to categorize or how to pull out the details that you need. So when they were using their sources less descriptively but more analytically, it was for things like outlining goals. Why would you use this strategy? Or why would someone respond to this strategy? What might be their response and why might they feel that way? Or as a professional, what's your role in this context? Rather than this is what the model is. One of the things that I found particularly interesting that came out of this was how students reported research findings. So one of the pieces of information that students received very explicitly in this unit, they had a great deal of information about what counts as a credible source in a piece of academic writing. This was something that the lecturer for this unit was very, very interested in, and he wanted to communicate that quite clearly to the students. So students were given examples of the kinds of sources that were useful, the kinds of things they ought to be reading. And again, for the most part, students were really attempting to meet that. So you would see them using peer-reviewed research articles or the kinds of websites that they had been pointed to by their lecturer. I saw very, very little Wikipedia or about.com in a first semester assignment. I found that quite heartening. But what was interesting is when they were using peer-reviewed research articles, they weren't necessarily using the findings, they were using information from the introduction. They were using the definitions of terms from their peer-reviewed research articles. And so they would use those definitions And when they would use the data, often the data was to identify a behavior or identify a problem rather than to suggest the solution. So you can see in the first example, they're looking at studies that talk about why students gamble. And then in the next one, you have information about what nicotine, how that affects people. But again, the purpose of the assignment was to talk about how healthcare providers use a model with a patient. The behavior was almost of secondary importance here, but many students spent a great deal of their source use and of very academically credible sources talking about what the behavior was rather than how that behavior could be changed. Another aspect that was considered to be evaluative or analytical rather than descriptive was when students identified healthcare provider goals. So what were they trying to achieve in this category? Which is, again, it's an important thing for students to do, but often what would happen is students would focus their source use on defining the larger goal, and then when they provided the specific strategies that might be used to meet that goal, they didn't cite them. And again, in some of the interviews, I was asking students, let's have a look at this. So you've provided some very interesting strategies here, but there's no reference to the literature about how did you know that these were good strategies? And some of the things that came out was students would say things like, well, we talked about it a lot in class. So I assumed that the lecturer knew what those strategies were, and they wanted me to indicate that I learned that in class, so I didn't think I needed to cite it. Another response that I got more than once from students was, I thought that was what they want, I thought that was the purpose of this, was for me to use my creativity in my imagination to read the literature, to look at what my goals were, and to speculate on what some strategies could be, and that I was supposed to come up with that, and I didn't need to cite that because this is what I came up with out of my own creative thinking. So I found that, again, very interesting. So I'm whipping through this. What does it mean? I think I come back to this idea again that it can be tempting to segment students into language groups or NESB, international or local students, and say this is an issue that international students struggle with or non-English speaking background students struggle with. I think in terms of how students use sources and how they incorporate evidence into their writing, this is something that beginning students struggle with. And it's across all of the course groups, the more prepared, the less prepared, the language backgrounds and the visa status, all of them could benefit, I think, from more explicit information about how evidence works in a piece of writing. These students, I felt from my analysis, indicated that they had a basic understanding of what the structure of an academic essay ought to look like. They recognized that they were required to use sources from credible publications and credible sources. They understood where inside the structure that should go. Whether or not they were doing that particularly well, they were at least aware that that was one of the requirements. Where I feel like they are less confident and less understanding is how evidence is used in a piece of academic and writing and the role that it can play in creating an argument in a piece of evidence in that. And again, true for all the students across the groups from the quantitative analysis. Students in their assignments indicated that when you ask them, when I asked them in the interviews, what kinds of things have you been taught about how you use evidence in a piece of academic writing? They consistently mentioned things like, I have to use this kind of referencing system, or I have to have more information in my body, I have to have evidence in my body from my sources, or I understand that I need to use things from the library collections rather than general web pages. I would also ask students questions like, did anyone ever teach you how to paraphrase or how to incorporate a piece of evidence into a sentence, for example? And students would go, oh no, I don't really think that ever happened. And then I would ask them, well, tell me about a teacher that you feel made a difference to how you developed as a writer. And they would talk about oftentimes high school teachers in English or history who would say things like, it's important that you show that you understand what it's about and that you use your own words. So sometimes I think also the difficulty is that perhaps they are receiving this kind of instruction, but they don't recognize that in the context of their new university setting. So people have been talking to them about evidence and how it works, but it hasn't been, in their minds, it's not clear how they take that to a university setting. Do I have any information on how they synthesize sources? Could you clarify a little bit? Do you mean synthesized as in incorporated into the sentence? It's very strange sitting here by myself reading questions. One of the things that I asked them in the interviews, this didn't come out in the quantitative analysis, but I asked them, when you come across in your research sources that are on the same topic but whose authors take opposing viewpoints, what do you do? And the majority of this, I interviewed 16 students, and almost exclusively students, I think there might have been one or two, everybody else said, I skip it. Basically what I do is I think about what I learned in class, I think about what I want to say in my assignment, and I pick the source that either makes most sense to me or that helps me make the answer that I think my lecturer wants. And a lot of the things that we talked about, a lot of the language that students were using was around, how do I give the lecturer what they want? And so I think that's very interesting, that question there on how do you reconcile the conflict between reputable sources. And students often just said, I don't. I just skip it. So at the moment, my purpose is to finish my PhD this year. So I'm writing up the quantitative analysis is pretty well written up. I'm working on the qualitative, all that interview data. I'm going through it right now and trying to construct a meaningful analysis of that. I'm following Lillis's structure of talk around text. So I asked students in the interviews generally kind of what kinds of things have you been taught about academic writing and how do you use that? And then could you choose a place in the assignment where you either felt like you use sources very well or you are concerned about how you use sources, and talk to me about what you did there. And I'm also going to be looking at in more detail kinds of the things that they were provided in advance of the writing. And so the qualitative research questions that hopefully will come out of this data is, how do they understand the role of intertextuality based on what they say about what they were taught? And then how does that inform their use of sources in the task, where I'll look at the sections where they used it and look at what they had to say about how they used it and how that relates to what the quantitative findings were. My larger goal for this, because I am working as an academic skills advisor here, it is already informing, I think, the materials that I sort of, when I approach teaching, I think we're talking about how we look at supporting students around the use of evidence more broadly. They are getting a lot of information around the mechanics of the referencing system and the general structural elements, but I do think it's important for us as language and learning advisors that we do move into those more conceptual ideas about how it can be used. And it also kind of comes into how you break down the question and how you understand which aspects of it are going to allow you to demonstrate your critical thinking and your learning best, and how sources help you do that. So there's the references just for this presentation. There'll be a squillion more for the thesis itself, of course. So what would be my top tip to share with students? One of the things that has really come out of this concept of talk around text as I've been reading more of Lillis's publications is one of the really deep premises of that research method is understanding the student's perspective and allowing them to say to you what they understand of their context. So, and even if that disrupts your research agenda or your support agenda, it's really listening to them and seeing from what they produce and what they say what their understanding is. And I know that it can often be very tempting as a student comes in because sometimes they don't have the language to talk about how they're approaching their writing or what they're doing with their sources, and often they want to come in and say, can you tell me what's wrong with this, you know, fix this for me or help me fix it. And even in those individual consultations, I think really it's paramount to say, let's step back and let's talk a little bit about what your understanding of the context is and what you've been, tell me what you're trying to do here and what your goal is. And let's talk about how that fits with what the expectation of the university or your lecturer might be and what you understand that to be, rather than saying, I think you need a citation here, or I think that's not. Do you know what I mean? Great. So are there any other questions, or I'll just quickly pop in my email address here. You are very welcome to contact me by email. I'm happy to discuss this more with you, or if any of you are especially interested in the trans-theoretical model, we can talk about that. Thank you very much. Thanks. I thought that for me, when I first did the quantitative analysis, I was really worried. I'm like, I'm not finding differences between these groups. What does that mean? And I was freaking out a little bit, like, oh my God, I've done all this work and I don't have any findings. And then when I actually kind of dug down into it, what I realized was, again, we expect to find that it's a language thing or that it's international students versus local students thing. Again, I really do think it speaks to the fact that there's a process of induction that all beginning students are going to need into the academic culture, and particularly around how evidence works and what counts as evidence and how it should be used in academic conversations, which is what they're doing when they're writing. Oh, and thanks, Anne-Marie. That's a very, very kind comment. So I guess just to conclude, if, again, I'm sort of in that stage of the writing up of the thesis, if you have any suggestions or any recommendations of publications or suggestions around ways that this information could be presented so that it's very clear or that the information comes through very well, please, by all means, pass those along. I very much appreciate it. So in the comments here, there's a question that the perception is a barrier. I think that is very true. That it's easy to make an assumption about what students think or how they're approaching things, and until we actually pull out of them what they're trying to do and let them take agency and sort of be in control of what their writing is and what they want to communicate and how they can do that within the expectations of the university. Yes, it is. And that's what I think is often the challenge here, because how to use sources and how to use evidence, it's challenging for published writers. It's challenging for the most expert of writers. It's not an easy thing to do. It's far easier to say an essay has an introduction, a body, or a conclusion, or in a reference list when you're using APA, the full stop goes here. Those are things that are quick and easy conversations, relatively speaking, whereas how do you really communicate the role of evidence, that's a more complicated thing, and I think it requires a different approach in some ways. And definitely scaffolding, yeah. And scaffolding within a disciplinary context. That it's something that's so specific. And that, again, I think came through with these students. These are health sciences students doing a psychology unit. And so I think for many of them, it comes back to that idea of what do you do when authors disagree with each other. One of the things that came through in the interviews very clearly was students were saying, man, I really do prefer my science courses because there's a right answer, there's a black, there's a white, I know what the answer is. Here, I have a really difficult time determining how to make sense of all the different perspectives that people have. So let's go back to science, many of them said. Yeah, and even, I mean, within a discipline, but I think it's also important, and this is something I think that will be important for me to stress as I'm writing up this aspect of it, is that even within a discipline, disciplines now are broad, you know? So as a health scientist, you will do a psychology unit, as, you know, and people are studying cross-disciplinary. So I think that's also important to recognize that there's a lot of, it's a very complex aspect of writing. I agree, Margaret, that the more that it can be built into the kinds of instruction that they receive in their units, the more effective it's going to be. They can't avoid it there. You know, they don't have to come to our workshops. They may not necessarily check out our online resources, but if it's part of the accessible content of the unit, they can't miss it, or they can, but they're less likely to. And I think that's something that's come out in previous discussions about this, that Anna was referring to the fact that oftentimes content specialists don't see themselves as having a role, and I'm paraphrasing here broadly, so apologize, Anna, if I misrepresent you, that they see that their primary goal is to teach content, that they're not as comfortable helping students address language issues. And part of what I see our role is when we work with academics is saying, you are a professional, you are a competent professional in the field who is inducting students, and who better to help them see language in context than you? You may not have necessarily all the language and the linguistics around why it works that way, but you have an inherent understanding that we can help you communicate to students and make clear in your curriculum. Yeah. And Simon, I take you, when you say they are very focused on content, part of, I think, what our role is to say, language is content. How can you demonstrate a mastery of content without the disciplinary language to do so effectively? And Victoria, I do think it is part of our role. In some ways, it is not. It is about building up the confidence of academic staff so that they feel like they know how to address these aspects in student writing, which I thought was so interesting about Anna's presentation right before this, is how a lot of what she's doing is focusing with staff on how they can provide feedback to students around their writing that's meaningful, because we all know that feedback that comes from the marker is more likely to hit home, I think. And they have so much more access to those students as well. So focusing on staff feedback, I think, in this area could also be quite valuable.